Thank you so much to Dr. Hawley and to the entire spine section for the opportunity to present today. As he said, I'm Corinna Zygourakis from Stanford University, and I'm thrilled to speak with you today about what I consider a really exciting and growing area in spine surgery. Here are my disclosures in terms of funding for our trial, and also, since we are in the technology session, I did use some of our latest AI tools to help edit this PowerPoint. So what's the current state of tracking for our spine patients? We're all familiar with these PROM surveys that have really become the gold standard. These patient-reported outcome measures are really limited in the sense that they're subjective, they're episodic, they're telling us how patients are doing at one fixed time point when we see them in clinic or they fill out the survey. And there's definitely the potential for both recall bias and white coat effect. In contrast, wearable data offers the promise of objective data that's continuously and passively collected that can help shine the blind spots in the perioperative care for our patients. There's been an emerging field outside of spine surgery using wearable technologies in other aspects of perioperative care. This includes abdominal surgeries, total knee replacements where they're doing activity and mobility tracking. There's some continuous physiological monitoring for post-op patients in the ICU. There's even been some colorectal surgery patients where they've done home and remote monitoring with wearables. And recently a study for pediatric appendectomy cases where they showed that a wearable was able to predict complications 3 days before the patients had to come back to the ER. Within spine surgery, the work has been much more limited. This study actually dates back a decade to Ralph Mobbs in Australia, and he put a Fitbit on 30 patients who underwent lumbar spine surgery. His main finding was that patients' activity did improve at 3 months post-operatively, but interestingly, there was no correlation with their reported PROMs. And our group at Stanford did a small preliminary study using a low-cost accelerometer, the Mi Band. We tracked 30 patients for 1 year post-operatively. In contrast to Mobbs and his group, we found that patients actually returned to their preoperative baseline level of activity. They did not improve over baseline. And like him, we found that there was no correlation between their objective daily step count and their subjective PROMs. So this is what inspired me to design and lead SpineTrack, which is the first RCT using the Apple Watch in elective spine care. And we randomized patients one-to-one to either the Apple Watch or the control group. The Apple Watch patients received an Apple Watch, which they wore preoperatively for 2 to 6 weeks and 1 year postoperatively. And at each of their postoperative visits, they received an activity tracking report with their Apple Watch data. Both the Apple Watch patients and the control patients received the same surgeries, and they both filled out all of the same PROMs for 1 year complete follow-up. These are some of the metrics that we collected from the Apple Watch, including total steps, distance traveled, flights climbed, stand time, exercise time, heart rate, and heart rate variability. And you can see here a sample activity report given to one of the Apple Watch patients at their postoperative visit. We enrolled over 200 patients, and the final analysis, which is completed here, includes 96 patients in the Apple Watch group, 91 in the control group, with 1 year of full postoperative data. So first, we wanted to see whether using the Apple Watch is feasible and useful. And so what we found here is that patients had excellent compliance. They wore the Apple Watch for over 14 hours a day, and they continued to wear it even over the course of the entire 1 year study. We found that the majority of patients said that the Apple Watch, they were either extremely satisfied or very satisfied with the use of the Apple Watch in their spine care. And that the majority of them also said that it was either extremely, very, or adequately helpful for them to see these activity reports at their postoperative visits. For surgeons, we had over 95% saying that they strongly agreed that the Apple Watch summary helped them understand how their patients were doing after surgery. And interestingly, even though the patients had the same surgeries that the surgeons were recommending to them, and we didn't really change anything in their actual care, the Apple Watch patients were significantly more likely to be extremely satisfied with their surgical outcome. So next, we wanted to see, do patients actually get better objectively after spine surgery? So here you can see our longitudinal data in terms of the objective metrics. And as expected, patients have an initial dip at the time of surgery, and then they increase postoperatively up to 1 year post-op. On average, across our patient cohort, it's about 1,200 mean steps per day of improvement. But when we look at it within different patient populations, you can see our cervical patients on the left, lumbar on the right. It seems like the cervical patients are getting back to their baseline, and the lumbar patients are actually improving in their mobility over baseline. And this is borne out in other objective measures as well. So now that we're collecting all this objective data, how do we make sense of it? Because we don't really know what's normal because we don't have all of this objective data on our patients. So one of the first things that we did was we used our preoperative data in order to understand what's normal for a patient with cervical spine disease or lumbar spine disease. And just like we have Z-scores that we create that are age and gender matched for patients with osteoporosis or osteopenia, we created Z-scores by standardizing our cervical disease patients relative to thousands of patients of data collected with the IMPACT study, as well as our lumbar spine patients separately. So here you can see a novel performance classification system that we came up with that shows mean step counts for patients with cervical spine disease compared to the average population. If no impairment patients walk over 9,000 steps a day, those with severe impairment walk 1,600 steps a day. And we did a similar analysis for our lumbar spine disease patients as well. And in order to confirm confirm the accuracy of this type of classification system, we also found that it does correlate with the subjective PROMs. Looking further at all of our 1 year of objective wearable data, we wanted to see whether this correlates with patients' PROMs. And here the story is a little bit different, okay? We actually did not find a correlation with most of the PROMs, except for some low to moderate correlations with a few of the physical function subcomponents of specific PROMs. And here you can see a patient that has parallel recovery trajectories where they're improving significantly both objectively as well as on their subjective PROMs, whereas this is a discordant patient where they had some improvement objectively, but their PROMs actually did not improve. We did unsupervised clustering in order to determine different trajectory recovery profiles, and you can see the 5 clusters here with a fast trajectory at the top to a very slow trajectory at the bottom. And we can actually define exactly how many days a patient will take to return to baseline activity data based off of which cluster they fall into. And we can do predictive modeling using our preoperative clinical, surgical, PROM, and wearable data to predict with pretty good AUCs in the 0.8s of whether patients will fall into the fast or slow recovery trajectory group. So in conclusion, wearable activity data provides objective, complementary insights that don't replace PROMs. There are significant differences emerging regarding the clinical utility of continuous tracking for different types of spinal diseases. And I think it's really important for us to remember some of the challenges. Continuous tracking is feasible, as we've shown, but it's expensive, it's time-consuming. I don't have an off-the-shelf product that I can give you that's HIPAA compliant that you can use to deploy at your institution based off of what we did. So if we're thinking about whether or not the future and all patients should be tracked, we should realize that while it's feasible, there's definitely a big issue with data overload. We have to go through lots of streams of data to figure out what's clinically useful. We have to consider the high cost versus the yield of what this data is giving us. So maybe we consider it for some of our higher risk spine populations rather than across the board routine monitoring. I want to thank the huge team that worked on this study with me, and I encourage anyone to reach out with any questions or potential collaborations. Thank you.